What's up, everybody? How are we? Welcome to another episode of the Performance Medicine Show. We are live this Tuesday, January 3rd. Happy New Year. Happy New Year, everybody. I see Robert's in here. Let's see. Robert, thank you for taking us with you on your road trips, man. I really appreciate that. Alice, what's going on? Great to see everybody. We're going to let some people get in here. Bianca, how's it going? Happy New Year to you. Hope everything in Nashville is wonderful. Lisa, thank you for sharing as always. Lisa shares the broadcast every single week. Jack, what's going on, man? Great to see everybody. Thank y'all for hanging out with us tonight. We got a great show lined up for you. We got a couple great questions that came in throughout the week, and we're going to go straight into live questions. Let's see here. I'm not loving the way my shirt's looking, but that's okay. D. Lynn, what's up? Coal miner's daughter, what's up? Howdy. Over there on YouTube. Great to see everybody. Thank you to everybody who's returning, and thank you to all of our new listeners, our new watchers. Thank y'all for hanging out with us this evening. This is the Performance Medicine Show, where we answer your health and wellness questions every single Tuesday night at 7. We're going to bring Doc in here shortly. Welcome in, everybody. Welcome in. Thank you. Allison, Happy New Year to you. Max, I just shot you an email, and it was an apology email. I am so sorry, man. I did not get back to you when I said I would. If you could email me right now and remind me what I need to get you, man, I'm gonna definitely get that before the night's over. I'm super sorry, but I'll definitely take care of you there. Terry, what's up? Happy New Year. Welcome in, everybody. Welcome in. As you guys know, Tuesday is when our Performance Weekly goes out, our weekly newsletter. We had a couple new episodes up on YouTube that went out this week, and this first one is very timely. In the Common Sense MD, we talk about habits. Dr. Rogers talks about habits and behaviors that can help you achieve optimal or total health. He kind of talks a little bit about this book, a lot about this book. I'm sure many of you have listened to Atomic Habits from James Clear. Phenomenal book. I've read it. I feel like I read this every single year right around January. And Doc talks about this kind of in regards to health. So be sure to check that episode out this week. And then we had a brand new episode of Dive into Diet with nutrition coach Lucas Schmidt, where we talk about muscle growth. This is a very interesting podcast episode where Lucas kind of walks us through his own journey. I don't know if you guys know, but he was in the hospital for a couple weeks last year, lost a whole bunch of weight, lost a lot of muscle mass. And he talks about his journey to building his muscles back up. And he's a wealth of knowledge with fitness and nutrition. So that episode is super interesting. He talks about, what you should be eating, and he talks about different exercises that lead to muscle growth. And as you guys know, and Doc talks about this a lot, how important muscles are, especially as we get a little bit older. And then we had a throwback episode of Explain This out again this week on semaglutide. We talk about a lot about semaglutide over the last couple of weeks on the Performance Medicine Show. In this episode of Explain This, the star of the show, Robin Riddle, details exactly how semaglutide works, kind of how it's used in an integrated medical practice. So be sure to check that out if you haven't already. That was one of our most popular episodes of Explain This on the audio outlets as well as YouTube. So be sure to check that out. Let's see. We got some more people coming in here. Mark, hello, man. I love you. Lauren, what's going on? Great to see you in here. Smash the like button like D-Lynn says. Thank you so much. Terry, Happy New Year to you. Let's see if Doc is ready to roll, and we'll get this thing started. Welcome in everybody to the Performance Medicine Show. Thank you guys for hanging out with us this evening. Shelly, what's going on? Mark, great question there. Let's see what we got. And we are live in all places. I'm seeing. All right, we're ready to roll. Welcome in everybody. And let's welcome in Doc as well. What's going on, man?
Hey, Ben, how are you?
How are you?
I'm doing great.
I'm excited for this. Well, there it is, live on air.
Yeah, we have a new sign. You like that? That's first class, isn't it? Very first class.
I like that. I don't see Atomic Habits behind you, but Atomic Habits by James Clear it's a very popular book right now, as it has been this time of year, the last couple of years. And I know you reread it recently and talked a little bit about it on your podcast. But I don't see it. Is it up there somewhere? You're probably by your nightstand.
No, I think it's upstairs. But
well, man, how's the day going so far?
It's going great. Glad to be here. I'm glad to be back at work today after a week off. So it was a lot of fun.
Yeah.
Saw a lot of patients and we had a good time.
Are you growing your beard out?
Well, you see my face, how red it is? I told a lot of my patients today that I got shot with a pellet gun all over my face. But no, actually, I haven't shaved right here because every year right after Christmas, I put this cream on my face to kind of burn the actinic keratosis off my face, the sun damage. So it looks awful for a couple of weeks. I mean, I don't know if you can tell or not, but
yeah, that's
a lot of red, scabby stuff. So I always put this compounded mix of 5-FU and calposotrine, I think is how you say it, but it's pretty effective in clearing that stuff off. So I always kind of suffer for a couple of weeks as far as what I'll look like.
Is it?
So yeah, I haven't shaved yet. So,
can you shave while you do this, or do you have to? Or do you have to?
But it hurt. It would hurt.
Okay. So your face
it scabs up. It really scabs up. You look like a lobster for a couple of weeks.
Well, it's actually. I'm really glad you brought this up, and I didn't realize that's why you hadn't shaved. I can't tell that much now that I look a little closer. I can see some of the red spots there. But guys, if you have any questions around 5-FU, this is something that Doc does every year for his skin. He can detail it for you. He's right in the middle of it, as you can see. So y'all can ask questions if you have any questions about that. Doc, you ready to get into the show?
Yeah, sure.
All right, we're going to jump in here, guys. If you have a question for Dr. Rogers, we get to live questions here in the latter part of the show. Go ahead and put those in the comments. We're going to start with this is a fun one because we've talked a lot about LDN, and I'm not sure I've heard you talk about it along with leaky gut. So the question is, how does LDN help with leaky gut, if it does?
Low dose naltrexone, it's kind of an odd way the mechanism that it works. I use it really more for autoimmune diseases like Hashimoto's and MS, lupus, inflammatory bowel disease, which are usually autoimmune like ulcerative colitis and Crohn's, and which really come mostly from leaky gut. Leaky gut kind of starts it out. So maybe if we used LDN early for a leaky gut, it may prevent that autoimmune turning on yourself disease that can develop. So in that manner, it probably would help a leaky gut, but it kind of tricks your brain into releasing its own endorphins, which help inflammation. It's really an inflammatory fighter is what I think of it as. And it's really at high doses, naltrexone blocks the effects of opiates. At low doses, it kind of tricks your brain into releasing its own endorphins. Um, but it doesn't cause many side effects at all. The only thing I ever hear about it is maybe causes more dreams, vivid dreams, which really means you're getting more REM sleep. Um, so REM sleep's very important. I'm gonna really focus a lot this year on my own sleep habits. Um, I think really healthy guts and healthy sleep habits may be the most important part of your health. I was thinking about that over the weekend. If you have a healthy gut and you have great sleep habits and you're getting good restorative sleep, you're probably going to be pretty healthy.
Mm.
Um, you really are. I mean, healthy gut means eating the right kinds of foods for you. And sleep is where we kind of activate that autophagy, that repair process. And so I think those are two things everybody that's listening and all my patients need to think about this year is healthy gut, great sleep patterns.
Mm.
So that'll be our mantra this year for 2023. I really just thought of that, but certainly that's what I'm going to focus on, especially since I went through all those gut problems I had last year, after following a bout of a very mild case of COVID. At the same time, I'd had to go on some steroids and antibiotics. So knock on wood,
Yeah, it's super interesting you mentioned that around. I love that mantra, by the way. So guys, we're going to be talking more about that. So I think in the performance medicine show community here, healthy guts and sleep patterns. And I think Dr. Andrew Huberman talks really, I love the way he talks around sleep. And it seems to me that one of the keys is getting sunlight first thing. So like going outside and even on a cloudy day, there's still sunlight, even if you don't think it's there. But that kind of sets the circadian rhythm. And I think that's going to help, or I think that's supposed to help you go to sleep. So guys, that's what we're going to be talking about, that 2023 healthy guts and healthy sleep patterns. Did I say that right, Doc?
You did. I was listening to a great podcast this weekend. Dr. Atiya had a well-known neurologist on with him from one of the Ivy League schools. I think it was Cornell. But she was talking about the neurodegenerative diseases like that we're seeing so much of now. Not only Alzheimer's, but Parkinson's. There's been a huge increase in the rate of Parkinson's in the last 20 years. And certainly we've seen a lot of it. And the other neurodegenerative diseases like Lewy body dementia, ALS, frontal temporal lobe syndrome. But anyway, she made a very interesting comment that I really remembered. And that she said, if you have this disorder, it's of REM sleep. I forgot exactly what she termed it, but basically, it's an interference of your REM sleep where you kind of act out your dreams, like where you start hitting your spouse, or you'll sleepwalk, or you really very fitful acting out dreams. If you have that, you've got like a 90% risk of getting a neurodegenerative disease, especially Parkinson's. That is scary.
That is.
That's really scary. And
wonder
she
if there's
stood by this pretty strongly.
I'm assuming there's nothing. Is there anything you can do for that? Like
that's what Dr. Atiya said. Yeah, she said you need to figure it out. First, of course, start with a sleep study and figure out, track your REM. And a lot of it has to do with the observation of your partner, bed partner. And certainly, I think so. Nobody's ever really looked at that in detail. Well, there will be now, because those are two famous people that were talking about it. And certainly you can get your sleep patterns in line. Um, whether it takes medications like LDN, like we're talking about, which definitely helps your REM sleep. So that's going to be really interesting.
I, I,
So
won- I wonder if when you say track your REM, does it matter at what point in the night you're in REM? Like, is that what tracking it means, or just a matter of how much you're getting?
mostly how much,
Okay.
you can do it with your Aura ring like I have, or your Whoop band. There's several devices that will track it for you. But it's really important. The
Hmm.
REM sleep is really important. It's a deep sleep. It's a deep restorative sleep. It's where you get your growth processes going,
It, like,
repair.
I haven't listened to the podcast with Dr. Atia, but it seems to me that if you're in that deep of sleep where you're kind of acting out your dreams, that to me would seem like you're in a really deep sleep, and that would be a good thing. But it seems the way they're talking about it is that it's a bad thing.
Apparently, it's not.
That's interesting.
It's not normal REM sleep. It's not
Hmm.
that common.
Okay.
It's not that common.
I see Julie Ray's got a great question. We're going to get to that. Sue, Happy New Year to you. Stan, I see your question around type 2 diabetes. That's a great question. Let's get to this next one here. Came in over email. If you have insulin resistance but have had pancreatitis before, should you avoid a high-fat, low-carb diet? Of course, the high-fat, low-carb diet is something you talk a lot about, and we all know you're a big proponent of. What's your thoughts on this?
Well, if you have insulin resistance or pre-diabetes, you definitely need a low-carb diet. And it depends on what caused the pancreatitis, whether it was gallstone pancreatitis, whether it was caused by alcohol. There's a lot of triggers. So not necessarily, you don't necessarily need to avoid a high-fat, low-carb diet in that situation. But it'd be nice to figure out why you had pancreatitis. It could have been from high triglycerides. That's a common cause of pancreatitis.
Mm.
And those people, they probably should eat less fats. Maybe instead of high fat, moderate fat, but still low carb, moderate protein. So it's a great question. So not necessarily. One thing about if you've had pancreatitis, you should not use some of the tools we have to help diabetes and weight loss, like Ozempic and Mounjaro, which are great tools. Those should be the drugs of the decade for sure.
And that is kind of timely here. I just got a notification on Facebook, got a message saying, tell me about Ribelsis for weight loss, which is in that same category.
Yeah.
I want to make sure we get to this. So can you tell us a little bit, Doc, around about Ribelsis for weight loss? This is for somebody that has struggled with Mounjaro.
Yeah, well, Ribelsis is just an oral form of Ozempic semaglutide. So that's what it is. I don't think it works as well for weight loss as Ozempic does. But it's a daily pill that you take. You got to take it with just first thing in the morning on an empty stomach, just to get it down with a tiny bit of water, because it kind of sticks on your stomach. And that's because if you flush it through with too much water, it won't work. It can still cause a little nausea, but it's a good medication. Most of my patients prefer the once a week shot. Seems to work a little better, but in some cases, like if you're on Medicare, they won't cover Ozempic, but they may cover Ribelsis. And it's weird. Some people, I had several cases today where Mounjaro, had one case where Mounjaro worked great when Ozempic didn't do a thing. Another case where Mounjaro didn't do a thing and Ozempic worked better. So everybody's a little bit different. The Mounjaro has another little added ingredient. So, it's just kind of what you respond to the best. So if you take one of them and it doesn't work, you might want to try the other one.
Mm.
But, of course, you need to come in and talk to us about it. These are prescription medicines that sometimes require prior approval. The only problem with these medicines is, besides the nausea, is getting it covered by insurance. And there's hope that there's going to be some relief from that for weight loss and not just having to be a diabetic to use those medications. So,
great question there, and thank you for sending that in through Facebook. Let's get to this one, and I had not heard of this when this came over email. What are biophilia workouts, and what are health benefits of biophilia workouts? Have you heard of this before, or had
yeah,
you heard of
it just means you work out outdoors.
really?
Yeah, you're working out outside,
Huh.
Which is supposed to just help you breathe better, just feel better because you're outside. I mean, there's a lot of good things to it. I mean, if the weather's fine and you can kind of connect with the earth, you're breathing in that fresh air, not just outside in LA or somewhere, maybe not even Kingsport, but out in the woods, in
Ah,
green spaces where you have all the plants. That's another good reason you should put plants in your house,
yeah.
because it helps you breathe better. It makes the air cleaner. So, and the other thing about that is something I've been doing. It's called earthing or grounding. And that's where you connect with the earth. As a matter of fact, I told you that I had bought a grounding mattress pad and also grounding pillow covers, where you hook it into a grounding outlet in your electrical outlet, and it really it's complex. I've got through reading a book on it about a month ago, and I've always heard about it, how you should walk barefoot on the grass, because when we wear rubber shoes, it really takes all that connectivity from the earth to your body out. Same thing with sleeping on a mattress. I mean, people were healthier when they walked in the dirt and when they slept on the dirt, really. And it all has to do with electrons. We're electrical creatures, really. I mean, we've got all these this thing, complex biochemical thing in our body called the electron transport chain, and a lot of chemical reactions depend on charges. These electrons flying around, and that's how oxidative stress gets going. Is all these free electrons going around, and it turns out that the Earth has a lot of these electrons. The Earth has a negative charge. Your body has a positive charge. So your
Hmm.
body, because of even just sunlight, can cause a lot of free radical damage to your skin. So can bad food. So if you have a lot of these free radicals that are scavenging your cells, the mitochondria won't work right. It gets kind of complex, but basically, what grounding does is kind of sends these negative charges into your body to round up all these free radicals that are damaging your body through inflammation. So there's a great book on earthing. If you read it, it's a really important discovery, and that's why I spent $500 getting grounded. I'm certainly going to, walk more in shoes that don't have rubber on them, like
Hmm.
moccasins, and bare feet if you can, and on the earth. I mean, it's not hokey. It really is a big thing. So
What's that?
that can kind of go along with it, working outdoors, preferably in earthing shoes, moccasins, or your bare feet. Um,
What's the book? Do you know or do you remember the title of the book? Just in case people
I've
are
got it upstairs. I'll get Jenny to bring it down, but it's called
okay.
earthing,
It's
which is
called
another
Earthing.
earthing, which is another word for grounding.
Mm.
And I I actually read that book and it convinced me enough to try it. And I've talked to a lot of people who do this, and they say their back and their joints feel a lot better once they start doing this.
Yeah.
But the biophilia workouts are kind of they hold to that promise, plus the fact that you're breathing better air and you're out in the sun. Here it is. Thank you.
Nice. Looking at.
Do you see that?
Interesting.
Interesting.
Yeah, that's super
great
fascinating. I've one of our friends used to ground outside his house, and I want to say there was like probiotics in the dirt as well. Like there
are,
he would use it for the probiotic, and it's really fascinating stuff. There it is. I see Cindy put in the book title as well as Katie. The book Earthing, super interesting. Clinton Ober, cool,
yeah.
And really fascinating. Thank you for sharing that.
A lot of really intelligent people that I know, they do grounding.
Yeah. Fascinating stuff. And guys, what that's going to signal to everyone in here live with us is go ahead and put your question in for Doc. That's all the questions that came in throughout the week. If I missed a question, if you sent in a question and I didn't get to it, I'm kind of got my eyes on my email right now as well. So go ahead and send in your question or just ping me again. I apologize in advance if I've missed anybody. So let's go ahead and put questions in the comments. Doc, we're gonna get to these here. Super cool. I'm seeing a lot of new names. Thank you guys so much for hanging out with us.
Happy New Year.
Happy New Year to everybody. Excited to bring in 2023 with everyone in here. All right, let's start with. I just want to put this up so you can see from Robert. Robert takes the podcast with him on the road. Thank you for that, Robert.
Thank you. Thank you. Yeah, we spend a lot of time researching this stuff. The one I did today, I particularly liked on habits and behaviors. I always like to do something like that to start the new year because, when you're a family doc, you see a lot of bad habits and then behaviors. Habits are behaviors, really. And it's a pretty cool podcast. I did a lot of research to put into this one.
Well, it's kind of the way I've described it to people who are asking today. There's Jenny.
Welcome.
Welcome in, Mom.
We got to see Jenny eating her dinner.
And Moose is the name. I didn't know. Moose is, I think, Bob's dog, isn't it? One of Bob's dogs?
No, Bob.
Bob's dog is Moose.
Is it Moose? Charlie and Moose.
I thought it was Moose.
Maybe it is Moose. Yeah. What brought that up?
The name I saw was Moose.
Okay.
Let's get to Mark's question here. This is one that's super interesting, and in typical Mark fashion, he's going to put some words in here that I can't pronounce. Nicotinamide mononucleotide, which I believe is NMN, has significant benefits in longevity, protection against heart and brain diseases, and prevention of premature skin aging. Is there a dosage and a brand? I believe this is something that Dr. Dave Sinclair has been talking a lot about in terms of anti-aging.
Yeah, he was really big on it. I listened to Atia's podcast a few months ago. He wasn't as big on it as he is something like rapamycin for aging, but a lot of people really like it. There just haven't been as many studies on it because it is a supplement, not a prescription medicine. But it's really, I like it. I mean, NMN is a precursor to NAD and NAD+, and that's where all the action is. because that is the part that repairs cells and helps in a lot of the energy connected with your mitochondria. So, you know, both of them are derivatives of vitamin B3, niacin. And whether you take the form NMN or NAD plus, Life Extension has a pretty good one of that generation. And actually, there's a few more that are kind of a little bit less well known that work pretty well too. And the NMR, I think Life Science or I think Life Science or something scientific brand, if you look it up, ranks pretty high. But most people that I know take the Life Extension NAD plus, and I think it's around 500 milligrams. I know you can go anywhere from 250 to 1,000 milligrams. I think 500 is an average dose of it, but yeah, a lot of people think it's one of the ultimate supplements for aging well, and can prevent, for example, like we just talked about, sun damage to your skin, which is what I'm trying to correct right now from years of being out in the sun, which has its benefits, but it also has its drawbacks if you get burned like I used to. Sun tans are fine, sun burns are bad. But I like NMN and I like NAD plus. They're both derivatives of niacin. So they're both good. So more energy, better cellular repair.
Is that something? Are we going to do a deeper dive on NMN or nicotinamide mononucleotide?
Yeah, we can.
I'm not
That'd
sure.
be a good podcast. That'd be a good podcast.
We've talked a lot about NAD plus. Maybe we'll do a common sense on NMN. Thank you, Mark, for
which is just a precursor to NAD plus. Yeah. It really is the active form. But certainly a great question. A lot of people
thank you
love
for that,
it.
Mark. I see Motaz is in here. Motaz, welcome in. Thank you so much for being with us tonight. Let's get to, let's see, Coal Miner's Daughter. Can you talk about what you know about mast cell activation syndrome and how you diagnose and treat it? I feel like this has come up a couple times.
Yeah, that's a fairly rare thing. The mast cells are those cells in your body that react to antigens, different proteins that you may have an allergic reaction to. So when you get mast cell, I'm not an expert on mast cell activation syndrome. I just don't see a lot of it. Usually the allergists deal with it, but something triggers it. A lot of people have this thing called multiple chemical sensitivity syndrome also that's probably related somewhat, but it's where you're allergic to so much stuff and you get you have rashes all the time. Your nose is always stuffed up. You have brain fog. It's a bad syndrome. And it may lead to a lot of other things like gut dysfunction and a lot of that stuff. I don't see a lot of it, and it's hard to diagnose. I usually, if I suspect it, I send somebody to an allergist for all these immunoglobulin tests and things like that I don't do a lot of. Treating it's tough. I mean, first of all, you try to balance the gut, eliminate those antigens or allergens that trigger it, and then you may need to be desensitized through either allergy shots or there can be some other stuff. I mean, you can always use antihistamines and things like that, and maybe H2 blockers. Anything that's more an antihistamine may help, but the main thing is try to find out what causes it and see if you can, through diet and avoidance of certain allergies, treat it. Something I've used for it in the past is LDN, something we just talked about. I think that helps, as well as regulating your gut. Remember, everything starts in your gut, but I apologize that I don't treat a lot of that. And if you've been diagnosed with it, you probably need to see a specialist.
Mm.
And then maybe somebody that's maybe thinks outside the box a little bit like I do with certain things like LDN. And there's another one called DHIST that I like it. That's a supplement made by Orthomolecular. It's a pretty good one for that.
Coal miner's daughter, thank you so much for that question. If you need us to follow up on anything, shoot me an email.
Sometimes you can do a blood count if you have a really high eosinophil count. That can be a clue to it. But I think mostly it's a clinical diagnosis.
Super interesting.
Great question, though.
Thank you for that question. Let's get to Allison here on Facebook. Does L-arginine help with fertility in the male and or female?
Yeah, a lot of people think it does. Along with L-citrulline, they promote nitric oxide promotion, which is great for male or female fertility. It increases blood supply to the testicles and the ovaries. So that's the way a lot of people think it works. It also helps build muscle in both sexes. So it's a really good supplement.
All right. Thank you for that.
Question.
Thank you for that, Allison. I want to put this up here. Shout out to Mama B's Place getting her first pellet today. Let us know how it goes. I tell you what, I think, did you once say that, that's one of the things that you've gotten the most thank for is pellets in women? Yeah.
I mean, if women are on hormone replacement therapy, they really ought to consider pellets. I think it's just the best way to get hormones, especially in females, because Mama B will know it doesn't barely hurt. It takes about a minute to get them in, and they last usually 4 months. You get a nice even release, and it just seems to work better. I know when Jenny got hers from the cream to the pellets, she said it was like night and day in the way she felt. And when they run out, you'll know it. In about 4 months, you'll be coming back in for more.
Mama B's, we're certainly proud of you. Keep us posted on how you're feeling. And with that, she has a great question here I'm going to put up. Want to try bromelain to possibly shrink nasal polyp. What dosage would you recommend? I have 500 milligram capsules by Natural Factors.
Yeah, that's about the right dose. And they, that in combination with maybe a nasal steroid, fluocinolone, is a good combination to shrink those nasal polyps down, because you don't want to have surgery for that unless you just can't get along with you're the second person today that's asked me about bromelain for nasal polyps.
Interesting.
Believe it or not.
All right. Thank you for that
try
question.
It's not gonna hurt you.
Thank you for that question, Mama B's Place. Let's get to my man Stan is asking, does drinking water affect blood sugar for type 2 diabetes?
Yeah, it should help it. It'll balance out your sugars a little bit. That's one reason in a type 1 diabetic, when they're going into DKA, diabetic ketoacidosis, all they want to do is drink water to kind of balance those sugars down, because they're losing so much water. So yeah, I mean, one thing I don't like to use New Year's resolutions, but when I walked into my office today, Sherry always has me at my big tall thing of water, my Yeti full of water. And I've told her I'm not leaving that office this year unless I've drank 2 full ones. So I think it does help your blood sugar. If you want to do an experiment, get a continuous glucose monitor like a Freestyle Libre and experiment around with it a little bit. I know I did, and it seemed to help it when I drank more water.
All right, people in the Kingsport office, let's hold Doc to that. Let's make sure he doesn't leave the office without two of those bottles done. And I'm going to put this up from Rose. Loving my pellet. No more hot flashes. That's amazing. Thank
Wonderful.
you for
Great.
putting that in there, Rose. And this is for all the Vol fans. The Vols are currently up. All right. Thank you, Bianca, for keeping us posted.
That's
here.
right. I forgot they play Mississippi State tonight.
Are they Mississippi State? Nah, I guess
Ole Miss. Maybe it's Ole Miss.
No, Ole Miss was a couple days ago. So I bet it is Mississippi State. Thank you for that, Bianca.
Oh, that's great. I hope we have a good team this year, and I think we're going to end up with our football team ranked about 4, aren't we?
Yeah, we should be. We had a great Orange Bowl a couple days ago. All right, let's get to the next question here. I actually didn't know this, Katie. Ben C., Fran, and Katie all do grounding at lunch. I think that's amazing. I need to read this book and start to consider this. All right, let me see where I'm at here. Let's go to Julie Ray. She's asking semaglutide injections versus semaglutide troches. Which is better? I didn't know there was troches. Is there, have you done this?
I haven't seen it or used a troche yet with this. I'd say maybe one of the compounders is making it now. I would say it would really relate to, you probably have to do the troches daily, kind of like you do Rybelsus, but I can see it. I can see them making them. So if you just have an aversion to shots, you could certainly try it. My dad, who was a physician, as you know, he told me that an injection always works better than a pill. I'll never forget him telling me that.
Is this in regards to
that.
Is this in regards to B12? Because I know, he had. Now it's a well-known story to me around the 3 phases of B12 with the doctor.
Yeah.
But obviously B12 comes in shot form. So
yeah, I know this is. He did tell me that B12 story as well. But this is all shots, like antibiotics, anything. So I think a shot is usually more effective than a pill overall.
Yeah.
You can look at it like an intravenous infusion or shot works better than anything in getting in there because it gets 100% in your cells. Then an intramuscular injection, sub-Q injection, lastly, and then maybe a sublingual under the tongue, and then a swallowing pill. I would say that's the order from most effective to least effective. Just like vitamin C, when you take a pill of vitamin C, only 20% of it gets to the cell. You take an IV injection in your vein intravenously, 100% of it gets to the cell.
Yeah. Super interesting. Julie Ray, thank you for that question there. And we'll have to look more into the semaglutide troches.
Yeah, I'm sure they're going to make them.
Let's see here. Where am I at? Jasmine, I see you. Our esthetician in Knoxville is
hey, Jasmine.
Is in the comments there. Thank you so much for hanging out with us, Jasmine. All right, let's get to the next question. Actually, I want to put this up just for the people who are on Facebook and can't see this. From Coal Miner's Daughter, my granny, who will turn 100 years old this year, wholeheartedly believes that staying connected to the ground and putting your hands and feet in the earth is a key to a good life. I think that's amazing.
That is, my mom also said that man was meant to work in the dirt, get your hands in the dirt. And I think that's very true from both a mental and a physical aspect.
Yeah.
I think it helps. There's a great book called Eat Dirt that tells about how you should not avoid being exposed to dirt. I mean, people think of it as dirty, but it's actually great for you. Don't eat it, but you should eat stuff that comes out of the dirt, unless you can't digest it, which is true for some people.
Super cool. And thank you so much for that, Coal Miner's Daughter. That's amazing. Lisa is asking what might cause tingling in your arms and fingers. It's not a constant happening. So it seems this is a little more periodically. What's your thoughts on this?
It could be a lot of things. It could be a pinched nerve from your neck. It could be elevated blood sugars, diabetes. That use is going to be in your feet too. pinched nerve, some kind of neuropathy. I mean, you can get a worst case scenario. I mean, even if it's really bad and it's, maybe associated with some motor dysfunction, even something like MS could cause it, which we see more in women than we do men. But hopefully not MS. But it just depends. You can get, studies, EMGs, to see where it's blocked off or where it might be compromised. You may have carpal tunnel. You may have a little stenosis in your cervical spine. So see if you have neck problems, see if your blood work's normal. Then you can consider nerve conduction studies to see how long it takes for those impulses to travel. That's not a fun thing to get done. They stick needles in you and then put current down it and measure the time it takes to get down to your digits. But definitely if it's one-sided, I'll think about doing that and maybe even getting the MRI of your neck or spine.
Lisa, thank you so much for that question.
Could also be a B6 deficiency. Try taking a little bit of B6.
That's a
just
good
100 milligrams. See what happens. That helps neuropathies.
100 milligrams of B6. I hope that helps, Lisa. Let's get to Megan's question here. I'm 58 years old and I did HR therapy, hormone replacement therapy, for 2 years due to menopause-related issues. It seemed to help some, but my doctor is not a hormone replacement fan. I stopped because I've heard such conflicting things about hormones. I've gained 15 pounds, which is a lot for me. Any thoughts? I know you got lots of thoughts around this. But first of all, Megan, thank you so much for this question, because so many, I know myself, so many people who are in the same situation with hormone replacement therapy. So, Doc,
great question. I run into this every day. Your doctor's not a fan of it because they're not knowledgeable about it. It's a basic thing. A lot of times when doctors aren't knowledgeable about something, they don't study it, they don't work with it every day, they poo-poo it because it's not absolutely mandatory, but it's so necessary in my opinion. They're probably going by studies that were done 30 years ago that were bad studies. Here's what I will tell you about hormones, why I'm a big fan of them. Because here's the fact, as your hormones decline, you decline in every way. It's like nature saying to you, you're finished reproducing, start dying. The problem is we're living a long time. So if you want to live that second half of your life without hormones, you're going to get brittle. You're going to age a lot faster. Believe it or not, you're more likely to get cancer and heart disease. Now, everybody got scared off of hormone replacement therapy, women, about 13 years ago when the Women's Health Initiative came out. Yeah, that was a tragedy to American women that study was described as it was. But in that study, using Premarin and Prempro, they came out with this big statement that there was a 25% increase in breast cancer. Well, it turns out that, number one, that wasn't even a hormone study. It was a cardiac study. The majority of the women in that study were 17 years past menopause, and they were using Premarin and Prempro. Now, with the Premarin only, and again, those are synthetic hormones. We don't use those kind of hormones. We use bioidentical hormones that come from plants that are identical to what you put out before when your ovaries were working. So they were using Premarin and Prempro. Premarin comes from pregnant horse urine. The progesterone part is medroxyprogesterone, which is not a good thing. It's a dangerous substance. It's not related to natural progesterone. But anyway, interestingly, in that Premarin only arm of the study, where they only used Premarin, it was actually less breast cancer. So therefore, you'd have to say estrogen does not cause breast cancer. Now, you don't want to give estrogen to a woman who already has breast cancer, but it does not cause breast cancer. Now, when they did the study with the Prim Pro, with the Premarin and the medroxyprogesterone, the incidence of breast cancer went from 4 women per 1,000 to 5 women per 1,000. 4 women per 1,000 got breast cancer without taking anything. Using the Prim Pro, 5 women per 1,000 got breast cancer. So they called that a 25% increase in breast cancer. I don't know how in the world they got that statistic. Listen to Dr. Atiya's opinion on this.
Yeah.
But anyway, so it's a bogus study, harmed a lot of women. And it's just not true. And so they're scared of it because they don't know much about it. It also makes, whenever I put any woman on any kind of hormone replacement, I want to make sure they have an up-to-date mammogram. Or if they just refuse to get a mammogram, I'm going to do a thermography. But I mean, it's a way to follow things anyway. But the other thing about that Women's Health Initiative study, half the women in that study were smokers, half the women were obese, besides being 17 years postmenopausal. Guys, that's what causes cancer, is obesity and smoking, not bioidentical hormones. So please think about that. You know, if you're a middle-aged woman like you are, if you take bioidentical hormones in midlife where you are, you're half as likely to get dementia as if you don't, and way less likely to get heart disease, which is the #1 killer of women as well as men. Why do you think women don't get heart disease before age 50 like men do? Because they have protective estrogen. Those are something, and here's what, why don't you go read a book all about women's hormones. It's called Women's Hormones by Dr. Pam Smith. To me, she's kind of the guru in the world of women's hormones. So your doctor's just not educated enough on hormones. It's interesting. Most of your gynecologists are not educated on it. They believe the old rhetoric from the Women's Health Initiative many years ago, and they haven't looked into it. It's just really, you got to take a deep dive on it. You got to have some experience with it. So what they ought to say is, I don't deal with that much. Let me send you somebody who I trust that does deal with it a lot and is going to do a good job with that. But it gives you so many advantages as you age, not only for, your brain and your bones and your heart, but from your skin, from your energy to your libido, to building muscle, burning fat, those type of things. So I hope that's a long-winded answer to your question, but that's the way I feel about it.
No, it's a great answer there. And Megan, thank you so much for putting this question in, because it's just such a common one. It's amazing how many women feel the exact same way. So thank you for starting that conversation with us here on the Performance Medicine Show. Let's keep going here. Let's see here. I'm going to get this from Josh. Joshua on YouTube was recently placed on 200 milligrams of testosterone enanthate and have been having issues with a very itchy rash that has flared up since start 2 weeks ago. Should I look at moving to the pellet to avoid this? What's your thoughts on this?
Yeah, I don't know if it's the first time. If the most common form of testosterone is cypionate. Enanthate, I use a lot of, especially if cypionate causes acne or swelling of the lower extremities, which it can rarely. So enanthate, in those cases, I'll put people on enanthate. But so what I would probably do is see if cypionate causes the same thing before I would do the pellets. Because once the pellets are in, they're in. We could take them out. Knock on wood, I've never had to take a pellet out, male or female. But before I'd put that in, I'd probably try cypionate. But most likely, the pellet is going to be better for you anyway. It gives a more even release, and it's really a more pure form of bioidentical testosterone. So I do like the pellets better, but for males or females. So let us know what happened with the cypionate, And first of all, stop the enanthate, see if it goes away. See if the itchy rash goes away. It could be something else. So, and then try cypionate for 2 or 3 weeks. If it comes back, you'll know, I can't take those 2 forms of testosterone. We could even try, a testosterone cream, which in men I don't like as much as the shots or pellets, but we could do that just to see if you had any kind of itching with that before we committed to put, 6 months worth of pellets in you. So that's kind of the way I look at it. So stop it for a while, try cypionate. If it does fine on that, stay on that. If it doesn't, try the cream. If you do great on the cream, go to the pellets, which I think are much more effective than the creams.
It seems Josh was on cypionate first, then was moved to the blend because the acne was horrible. This is the 3rd cycle. Okay, that makes sense.
So, yeah, there you go. I figured they'd use cypionate first. So stop it and see if the rash goes away first. And then we'll use a bioidentical cream, not the androgel or Testum. I'd use a compounded bioidentical pure hormone cream that we can get compounded for you. And then if you do well on that, then we'll put pellets in you.
All right, Josh, hope that helps. Let's go to, I want to make sure we get this question in. Let's see. And Penny, I'm not sure if I'm reading this correctly or not. So let me know if I'm wrong here. The question is, can you be healed with high secretory IgA? Secretory, do you know what that is, Doc?
Secretory IgA? Yeah, it's an immunoglobulin A, which is, find that more in the mucous membranes. I mean, a lot of the things that we do, both with the gut, which is a mucous membrane, and sinuses, nose, etc. There is a very protective effect of it. You don't want it too high or too low, and so there's a lot of experimenting around to see with this stuff, but it's just a really interesting topic. I don't know what you mean be healed with from chronic sinus or gut or what, but so you just have to get with us. And sometimes rarely I do it, but immunoglobulin studies and see. A lot of it has to do with gut function. And you can even do a GI map. If it's gut problems, you're talking about healing your gut, I suggest getting a GI map and looking at those levels. Great question, though.
Thank you for that question, Penny. If we missed anything, go ahead. You can put in the comments and we'll get to that. I want to put this in from my brother, Steve. I get so much from my garden. He has a beautiful garden, by the way. I go there to change my mood or to get gratitude up. It works. Love putting my hands in the dirt. That's awesome. Such a good practice. Thank you for putting
There's
that in
two
there,
things Steve loved to get his hands on. One is the dirt. The other one's sourdough bread. Even when I make up the sourdough, I knead it. I feel so good. It goes between your fingers and just makes you feel good. And taste even better. Yeah, gut. Okay. Yeah. Get a GI map. Get a GI map, Penny, and see where you.
So it seems she's been to the office. Levels are high. Okay.
Yeah. So if you've had a GI map, you need to talk to Robin. If she can't heal your gut, you're going to have a hard time getting it healed. But a lot of times, there's a lot of things you can do with that, with balancing that gut microbiome. So that's a great question. I hope we can help you with this. We'll look into it a little further. I'll have to check and see what studies you've had done.
Penny, thank you for putting those questions in there. Let's see. I know I'm kind of all over the place, but I want to get to as many as possible. I have recently been advised that eating protein along with taking ropinirole will reduce ropinirole's effectiveness in helping Parkinson's. And Doc, if I mispronounce that, correct me here. Do you agree?
I don't. Again, you're being treated by a neurologist for that. So I don't know. I'll be honest with you. I do not know because I don't use that drug. So I don't know. You're probably going to have to. I can look into that, but you probably need to ask your neurologist about that. Somebody who uses a lot of it for your Parkinson's. Again, I would think about LDN. Look into LDN if you haven't looked at that to help your Parkinson's. You may be missing out a little bit. So I'm not expert enough on that drug to tell you about how much protein you should eat.
Thank you for putting that in there, Allison. Let's move to Teresa here. So how do we go about getting the vitamin C IV versus the PO pill form? And this is in response to
just come in the office.
Needles versus oral.
Yeah.
So there's high dose vitamin C IVs. You can get that at a practice like ours or others. There's plenty of people who do that. I think, what's the test called? A G6PD that you need?
Yeah. Before you get a high dose vitamin C, you need a blood test called a G6PD, one time only, because there's a rare 1 in a million problem with that that could cause a little bleeding, but that's rare as hen's teeth. But I don't think I've ever seen one. But anyway, with the amount of vitamin C in a Myers, you don't even need to do that. But for example, Myers has about 8 grams of vitamin C in it. That's 8,000 milligrams, 8 grams, 100% of which is going into your cells, versus say you take a high dose, say 1,000, 2,000 milligrams of oral vitamin C, only 20% of that's going. So vitamin C is a great healer. It really is. I can't tell you how many times I've gotten a Myers cocktail when I've been sick or just felt really tired, jet lagged, whatever, and it really boosts me up. I had COVID. I got one every for 5 straight days, and just sailed along with it. So,
thank you for that question there, Teresa. Let's keep going here so we can get as many in as possible. I think where am I at? I want to get this from Gwen. I know I got one in my email too. I have a family member who was diagnosed with pancreatitis and hospitalized for 6 days. She is otherwise healthy and in her 30s. CT scans and MRIs were normal, but lipase was 3,000. Doctor could not find the cause, but assumes it might have been a virus that caused it. Any thoughts?
Yeah, it could have been. Could have been a virus. It could have been. Hopefully, they ruled out. I'm sure they ruled out gallstone pancreatitis, and hopefully triglycerides are normal. Don't drink alcohol. Don't eat a lot of fatty meals. With that, sometimes we just don't know why they had an episode of that. But certainly, you always think about viruses as precipitants of a major thing like that. Pancreatitis is not fun. Sometimes, that can throw your beta cells off too. So you need to look at your blood sugars and look at your metabolic, panels. Look at and make sure your liver's working right, and make sure those lipase and amylase levels come down to normal. Hopefully, it wasn't any kind of medicine that precipitated it. But sometimes we don't find that because you start to test for all these weird viruses. But it sure could have been if it's nothing obvious. Great observation, though.
Thank you for that, Gwen. Thank you for that. Let's get to this question that came on email real quick. It's long, so I'm just going to go ahead and read it here. Our 53-year-old daughter has recently been diagnosed with lung cancer that has metastasized to her liver. She lost her husband 2 years ago and has 3 sons, with one still in high school. From our research, chemo and immunotherapy alone do not lead to a very positive outcome. She has started chemo and immunotherapy last week. How would we find an MD or medical expert that could work with her to add appropriate nutrients and natural medicines to boost her immune system? We're seeking any option that might help her find a path to a cure, or at least a method to stabilize the cancer until a better option arrives. I say that because I know you have thoughts around this. You're a blend of the traditional with alternative. So how do you approach this? First of all, we're thinking about your daughter, and certainly praying for her.
Yeah, certainly. I'm sorry to hear about that. But one thing, don't lose hope for sure.
Mhm.
Definitely go with the traditional treatments at first and see how they're progressing. And I think if I had any form of cancer, the first thing, a couple of things I would do. Number one, I'd get on a ketogenic diet. Remember, cancer loves sugar. So at least cut out all sugars, and even a keto diet I would do. And I would think about getting some IV vitamin C treatments as the next step. You don't usually want to do that when you're on chemotherapy, although sometimes some of the oncologists will. I've even had a couple of them send patients to me to give them an IV vitamin C during the chemotherapy. That's not real common, but so that's something you could consider. And there's also some other alternative treatments, more holistic type things that using antifungals and herbs that may help a little bit. You could even go to one of our podcasts with Joel I think you did an outside the box with him.
Yeah.
He's a PhD that almost kind of cured his own cancer, throat cancer, by he did the traditional treatment and also added some alternative stuff. So that's something that needs to be looked into. We'll be glad to help you out if we can. Or there's a center in Asheville, North Carolina that does a pretty good job with this too. They deal a lot with that. And I'll have to find out. I don't know their number, I can't recall their name off the bat, but I've had a few patients go there for more of a holistic approach to it. But certainly don't ignore the traditional stuff and think about some things you can do with the gut and maybe some vitamin C.
Thank you for that question, and thank you for that answer, Doc. I know that's something that people approach you a lot with, just with that sort of question, how to approach it. So thank you for sharing kind of the way you look at it. Let's go. We got a couple more minutes here, guys. And I know Barbara's asking, what is grounding? Real quickly, how would you describe grounding for Barbara?
Oh, that's just connecting your body with the earth. One thing, just the simplest form, just walking with your bare feet in the dirt.
Yeah.
But because of it all has to do with electricity. Your body is an electrical circuit. It really is. Think about your heartbeat. It's driven by electricity. Every cell has a mechanism in it that it relies on to produce energy. It's called the electron transport chain. But grounding, from anywhere from walking in the dirt to wearing moccasins instead of rubber shoes. Like I said, I have a mattress pad that's grounded. It's you actually plug it into a grounding outlet in your outlet, and it just brings the electrons, which are negative charges, into your body, which it really is a scavenger for free radicals that do all this oxidative damage. So it acts like it decreases inflammation, which causes all diseases. So I think it's helpful. But read that book. You'll get a good take on it by the book Earthing by Clinton Ober. I got it right here. Read that book, Barbara.
Thank you for that, Barbara. Earthing there. We've got I don't think we have a link in the comments, but we do have the title in the comments. Let's get this to Stan real quick, and we'll get Dr. Reich coming up here. Let's see here. Will vitamin C shots jack up your blood sugar? So the way I understand it, Stan, is vitamin C is through an IV. There is vitamin D shots. Is there vitamin C shots as well? Am I off there?
Probably talking about IV vitamin C.
Yeah,
it can. So one thing that I do when I'm given an IV vitamin C, I never check a blood sugar in a diabetic while they're getting it, because it can make it go high or low. It's not accurate when you're actually in the process of getting it in your veins. So, but I just don't run into a problem with that. I mean, I've got 2 diabetic kids, and they get Myers cocktail occasionally. It doesn't seem to affect their sugar too much at all. But if you're a brittle diabetic and you're getting a high dose vitamin C, again, high dose vitamin C we're not going to use unless you've got a serious problem. A Myers cocktail almost anybody can get, but anyway, so the IV vitamin C possibly could if you're a brittle diabetic, and then don't check your sugars while you're getting it because it won't be accurate.
All right.
Great question, though.
Great question there, Stan. I see Katie's got your question there, Bianca, around the Myers cocktail. Thank you for that, Katie. Let's see. Let's get Dr. Ike on, and we will close out the show.
Come here. Here you go. Here he is. Can you see?
There's Dr. Ike, and Lisa's asking, "Where's Dr. Ike?"
Right there he is.
There's Dr. Ike. There he is. What's up, buddy?
He's just hungry. For
those new to the show, we bring on Dr. Ike at the end of every episode of the Performance Medicine Show. He kind of closes it out. He's our outro.
He does grounding every day. That's why he's so healthy.
He's a huge fan of grounding.
Yeah, he loves to ground.
I can't see your face now. Where's the?
Yeah, Dr. Ike messed my earplugs up.
I want to put this up here for the people who are still with us. This is something that we've talked a lot about on this show, and I just want to put it up for if I can find it. Let's see. Allison ordered a saffron from Life Extension. This is something we've been talking a ton about on this show. Saffron.
I love saffron.
You use it for weight loss, anxiety, just tons of different things. So
I didn't know we were out of it, but we try to keep big stock in our office, so you can order it, through Life Extension. But yeah, I think you'll really like it.
Yep.
It's just a really good without any side effects. I just don't think I've ever seen anybody with side effects. But
Allison, keep us posted on that. Roel, I love you, man. Thank you for being here. I see, man, there's so many. I want to give a couple. Carla, thank you for being in here. Penny, great questions. Joshua, I really hope that helps, man. Thanks so much for that thoughtful question. And Motaz with the great comment around, this, the Women's Health Initiative. We feel pretty strongly that it really hurt a lot of really a generation of women.
It did, yeah.
So thank you for that comment there, and thank you, Doc, for kind of walking us through the Women's Health Initiative and kind of the consequences of it. Anyways, guys, Doc, anything you want to add before we sign off?
No, I just hope everybody has a great 2023. We'll try to make it a healthier year, and let's focus on sleep and gut function.
And I see Robert's want more information on that Asheville, North Carolina Center.
Okay, we'll try to get that to you. Just email us, and Ben, I'll get that to you.
We'll get that to you there, Robert. We'll get you information on the Asheville, North Carolina Center. All right, guys, we're going to call it a show. Thank you all so much for hanging out with us this evening. This is the Performance Medicine Show where we answer your health and wellness question. We do this every single Tuesday at 7. Thank you so much for the people, first timers. Thank you so much for the people who are with us every single week. Katie Gagley, thank you so much for being in the comments and being such a resource for everyone that's with us live. I see Jasmine Allman, our esthetician. Thank you for hanging out with us this evening. To all of our offices, we love you. Thank you for all the work you're doing. Doc, thank you, man. I know it's been a long day.
Thank you, Ben. Thank you for all the work. And we'll see you soon.
Guys, we love you. Until next time, we'll see you next week on the Performance Medicine Show. My outro is here. I love you all.
Don't go away.